Today I'm going to be talking about caring for and communicating with nonverbal children. Imagine trying to help a child, but they can't tell you what they need. Not because they don't want to, but because they can't. Caring for nonverbal children comes with many struggles, but can feel very rewarding when you learn to communicate with each other. As a daycare provider with 2 nonverbal children, I have experienced both the struggles and rewards. When hearing the term nonverbal, there's bound to be questions. One of the most important questions is, well, why are they nonverbal? There are a few reasons that a child might be nonverbal. One of them is being on the autism spectrum. According to V. Rose, 25 to 35% of children with autism are nonverbal. Along with being nonverbal, they tend to struggle with social interactions, which can make communication even more difficult. However, Dr. Ron Malcolm said, lack of speech doesn't mean the person can't communicate. And, according to Gary Dawson and Lauren Elder, many children with autism eventually develop speech, it just might take a little longer. To help the children develop their speech, early intervention could increase the likeliness that they do develop it. Regardless of whether they get early intervention or not, they can communicate in other ways. The second reason a child might be nonverbal is childhood apraxia of speech. According to the Mayo Clinic, childhood apraxia of speech is a rare speech disorder where the child's brain has trouble controlling their speech movements. The symptoms might include sound distortion, pausing during words or syllables, and inconsistent speech. Some complications that may arise are that it can present similar to autism. They can have trouble with social interactions or kind of hide away from talking to people. They may also experience delayed speech or delayed development in reading, writing, and spelling. Whatever the reason behind the child being nonverbal, there are unique challenges. One of the challenges are behavioral changes. The most common behavioral change is seeing frustration or outbursts like this child here. According to Ron Malcolm, being nonverbal may show as frustration when the children are not being understood. And similarly, built-up frustration can lead to outbursts. Outbursts can also be used as a way to communicate. Another struggle that comes when communicating with nonverbal children is that not every strategy will work for every child. For example, if a child has apraxia of speech, some strategy better suited for autism might not work. A child with autism may struggle more because of their trouble with social interactions. Also, childhood apraxia of speech may be better suited for more intense speech therapy than autism. It is important to remember that not all communication is verbal, which can change the strategy that you use. It is important to focus on nonverbal communication more than verbal because it can be less intimidating for the child. If the child is not developing their speech, assistive devices or sign language can be used in place. When there are challenges with any situation, people will always come up with some sort of solution. One solution is interventions. There are some you can do at home. One of them is to find their interests and play into that interest. If they like cars, play with cars, teach them car words. If they like blocks, build towers, teach them words that revolve around that. When you do find something that interests them, you can imitate them throughout the experience. And over here, I have this imitation hierarchy, and it starts with actions with objects. So if they move, then you move. And then it moves all the way up to saying words. Another thing that's important to do is simplify your language. They can't understand you, but it might be easier for them to copy you if you're using simpler words. ABA therapy is based on learning and behavior to help learn skills, and it is usually used for children with autism. Speech therapy focuses on exercises, activities, and strategies to improve speech and language. If these solutions aren't working, there are alternative forms of communication. One is a picture exchange communication system, where the children use pictures to tell you what they want or need. It is commonly used with some sign language or gestures. Pictures increase the understanding of using pictures to communicate. This is a augmentative and alternative communication device. And what that does is the children can push the buttons and it'll spell out a sentence and essentially talk for them. They can also learn basic sign language and eventually become fluent if they don't develop speech. Now you know there are a few reasons children may be nonverbal, such as autism or childhood apraxia of speech, which were both mentioned here. Regardless of the reasons, challenges will arise. Thankfully, there are solutions that will allow you to better communicate with these children and others. With this information, you, as parents and caregivers, will know what to expect and think about ways to communicate with nonverbal children that you are around.